start over so it's done. The coalition also includes the Senior Agenda Coalition of Rhode Island, District 1199 SEIU New England, the Rhode Island Organizing Project, Sista Fire, Rhode Island Interfaith Coalition to Reduce Poverty, Women's Fund of Rhode Island, Newport Partnership for Families, Fuerza Laboral, Protect Our Healthcare Coalition, RAMP, Real Access Motivates Progress, the Economic Progress Institute, RIAFL-CIO, and Rhode Island Working Families. I was first propelled to this work by a traumatic experience with my husband in a Rhode Island dementia care facility. But in my work as a volunteer ombudsman since his death, I've seen and learned of much worse and more widespread and systemic problems in facilities across the state. We are here today with our legislative champions to talk about our holistic plan to heal our state's broken nursing home system. This plan includes two key pieces of legislation: the Nursing Home Workforce Standards Board Bill and the Financial Transparency Act. Both are pivotal in our work towards ensuring quality care and transparency in nursing homes. Too many vulnerable Rhode Islanders have suffered from poor care in nursing homes, and too many caregivers have felt burnt out and demoralized, unable to give the care their residents need. That's why, in 2019, even before the pandemic, Raise the Bar launched its campaign to end the staffing crisis and passed the Nursing Home Staffing and Quality Care Act. I would now like to introduce two individuals who were key in passing the staffing bill. First to speak is Stefania Silvestri, a registered nurse who has worked in nursing home care for over 20 years. Stefania?
I first would like to say how humbled I am to be invited to speak here today. Thank you for all inviting me. I have been part of Raise the Bar campaign since the very beginning. My name is Stefania Silvestri. I was born with Klippel-Trenaunay syndrome, and I've often had long hospital visits as a child. The nurses were like second mothers to me. Their kindness and ability to ease my pain was inspiring, and because of this, my dream was to work in the nursing field. In 2002, I began my career in the nursing field as a CNA, eventually earning my RN degree in 2014. Nursing and the specialized care we provide extends far outside of the facility. Advocating for the ethical treatments of patients and nurses became essential to creating a safe and therapeutic environment. 22 years ago, my starting wage at the Greenville Center was $9.50 an hour. This included medical benefit package that was free for a full-time employee. You could survive as a single person on a CNA's wage at the time. In 2002, the working environment was centralized on the residents' quality of life, therapeutic interventions, and adequate care. This environment only was possible because of the competent and fully staffed nursing and rehabilitation center. During this time, for example, we had 5 CNAs on each floor with an average of 8 to 10 patients per CNA. In 2019, we were consistently short-staffed at my facility, sometimes one CNA to 12 to 15 patients. Clearly, this did not provide any real quality of life, and both patients and staff were suffering. Families would often express significant concern as patients were having trouble receiving the treatments they were placed in the facility for. The facility that I worked for changed owners and management many times over the last 22 years. With each new owner, the standard of care became lower, and the focus was often profit. The staff is stretched thin, burnt out, and underpaid. The facility is less concerned about the welfare of the residents and more concerned about the way a resident's room looks than if they ate a meal or received their treatments on time. In 22 years, Greenville has gone from a 5-star facility to now a 1-star. A 1-star. Would you want your loved ones in a facility to have a reputation as a 1-star? Nursing has changed in the last 2 decades. With technology and new therapy interventions, what would have been a hospital stay can be achieved at a rehabilitation center. Originally, this was thought to be a good thing for a patient. Now we are caring for cancer and chemo, trach patients, dialysis, obesity, diabetes, amputees, cardiac rehabilitation, COPD, PICC line care, TPN, long-term antibiotic therapy for complicated infections, and so much more. Many of these patients are being sent to facilities without providing the higher level of support they need. Despite the increased ability of the facilities, the staffing levels never kept pace. Imagine for some of these residents, these will be the last months or the last years of their lives. It pains me that I know these residents deserved better but couldn't provide it because of the lack of resources provided to us. When the pandemic hit, we went from a low-level crisis to a full-blown catastrophe, and the bottom fell out. Once again, due to limited resources, the need outpaced the ability to care for patients, and many suffered and died. I would be putting one patient on oxygen, and the patient in the next room is on the floor, but I just couldn't get to them yet. The resident down the hall has a fever of 103, and they're yelling out in desperation, "Help me, help me." They're scared and delirious. There's nobody in sight. No one is coming to help. I can't get to him just yet either. How? How can you save them all, or at least ease their pain and suffering? There's only 3 to 4 staff members for 30 COVID patients. I place body after body in a body bag, day after day. The smell of that plastic from the body bag still paralyzes me. These were the residents I became close to over the years, and now I'm placing them in body bags. Every single day I sat in my car crying, then tried to compose myself by the time I drove home to my own family. It was heartbreaking, and I felt I couldn't do enough to save them, and I try to imagine how they felt, so alone and dying. Many nurses left the nursing profession because of this, and I often think, what would happen now if we had another pandemic with even less? At my facility, all the organized activities that gave our residents stimulation and dignity of life are gone. Instead of concerts and Christmas parties, holiday bazaars, and made-to-order breakfast, our residents eat in their rooms or a very small dining room on the unit. They have little social, mental, and spiritual stimulation. How are we as a society okay with this? Imagine if it was your loved one stuck in a bed all day or in a room all day with nothing to bring them joy. Imagine being treated like a task. You have to hurry up and get through that one to get to the next. Even with the increase in healthcare costs, this is still a familiar scene throughout the state. I thought that having our bill signed would bring this all to an end. These are human beings we're talking about. Parents, grandparents, aunts, uncles, friends, former police officers, nurses, and veterans. We need to do better. It was for all these reasons and more that I worked really hard with my fellow coworkers and nursing colleagues to pass the Nursing Home Staffing and Quality Care Act with the Raise the Bar campaign back in 2021. We were excited when Governor McKee signed the bill into law, which begs to question, why are we all standing here today? Why are we still fighting to end Rhode Island's staffing crisis? We are calling for the Workforce Standards Board that brings together voices of caregivers, industry reps, community allies, and the government to find a comprehensive solution so we can solve this staffing crisis. We are calling for more financial transparency. If homes like Greenville aren't spending money on wages and they're taking away all activities for residents, just what are they spending money on, public money on exactly? I'm out here today for my residents who I love. They're depending on us. They're depending on me. Like those nurses who loved me all those years ago, and for the nursing staff that works without breaks, on holidays, and dedicating their lives to caring for a stranger in need, the time is to act now. Thank you for having me.
Thank you so much, Stefania, for your powerful stories. As Stefania showed, nursing home short staffing is by no means a new phenomenon or a product of the pandemic. It's been part and parcel of the way for-profit nursing homes have run their businesses for decades. I would now like to introduce Sherman Pines, a former resident of a Centers Health Care facility who can speak directly to the care he received in a corporate facility. Sherman?
Hello, everyone. My name is Sherman Pines. I'm an advocate for the Newport Healthcare Advocate Group. During the COVID era, I was put into a nursing center in West Kingstown. I arrived in the middle of the night, and as I got there, it was freezing. I asked one of the staff, why is it so cold? They said, because the heat does not work, that we were waiting to have someone come and fix the furnace. Well, the next day, nice and warm. That night, cold again. So I'm like, wait a minute, why is it so cold now and it was nice today? Nurses said, we don't know. Come to find out, they turn it on during the daytime to keep anybody from coming in and inspecting them, and then at night they would turn it back off. My care was very inadequate. There was 2 staff, and it was almost like cloning the story that you just heard. There was about 2 staff to about 30 patients. I witnessed people at night crying out, help me, help me, help me. And I'm like, there's no one to help. The nurses are like, there's only 2 of us. Then I hear a Hispanic person in Spanish asking for help. There was no bilingual person there to help them. So they kept yelling and screaming, and I knew some Spanish, so I said to them what she wanted and what she was looking for. There was times, and because of the COVID, that I did my PT in my room because I couldn't go out to that center that they had set up. I wanted to go to the restroom at one point, and I asked and asked, but there was nobody to help me. It took a while to finally, one of the on-staff doctors said, let him use that restroom down at the end of the hall. I had one person to help and assist me. I was on a walker, so with the walker I was able to go with them, and they steadied me to get to that restroom. But when it was time that I finished, it took almost an hour to come back and get me because we had no one to do it. There were nurses, traveling nurses, brought in to help. But still, at night, there were still only 2 people. So I still didn't get the help I needed. I talked to some of the nurses, and they was very angry because they had no one to help them. But the traveling nurses, one quit. Says, I can't take this anymore. And they left, went back to where they came from. Because there was no one to help. And she just said, I can't take it anymore. I worked with patients similar in a nursing home. So I knew what it took for people to help you. Once they was going to get me up to do PT, and no one knew how to do it. So because I'd worked 10 years in this organization, I taught them how to lift me up. And they said, wow, this is easy. We was never taught this. They had no one to train them. So our big problem is in a lot of the nursing homes is the training and the short staffing. I worked with Raise the Bar on that last bill, and we thought that everything was fine. And as she said, McKee stopped it all, just turned it off. These nurses was very happy that, we are about to get a raise. But then it all got stopped. So I contacted some of those nurses to ask them, and they told me they couldn't talk to me. And I said, why not? We had to sign a non-disclosure act. Like, why? Because we can't tell them what's going on here. Because we would lose our jobs, and they needed those jobs. So they couldn't say anything to me. Being in that center was the worst thing I'd ever seen. There was clutter in the hallways. So if people are walking in the hallways, it's very unsafe for them. Especially, you got a walker, not like this, but you got the two-wheel walker. And you're trying to walk through a room, trying to go to the restroom with nobody to assist you. Very dangerous. I've been in a couple of the nursing homes, and one of the other ones was the same thing. There was nobody to help them. You ask for help, ring the buzzer, and you might as well sit there and wait because you're not getting any help. There's nobody to help you. I asked once for a glass of water. It took me an hour to get that glass of water. An hour. And one of the girls came to the door. She said, I'm sorry, but we have no one to help us, so I can't bring you that water. Why are you running a facility like that and have no staff? Why? They're supposed to be helping people, but they're not getting the help because there's no one there to help them. I had never seen anything like that before. And it hurt me to know that there people was not getting any help. And I knew how, but I couldn't help them. I don't work there, but I couldn't help them. And I would say to them, do this, do that, and I think you'll be better off. So what I've seen in nursing homes, it just don't work. It don't work. So we need to get back into the faces of these people that are supposed to be helping us to make these nursing homes safe. Tell them to go spend a week in a nursing home. Let them see if they're going to get the care that they should be getting. And they're looking for a staff to come and help them, and the staff is not there. They'll think about it. So let them try. I really appreciate you for allowing me to tell you the story and to see and hear what our nursing home has become. If we don't do something, we can forget it because we're done. Thank you.
Thank you so much, Sherman. No one should have to go through that kind of experience in a nursing home. It's worth mentioning also that the corporate owners of that facility, Centers Healthcare, that facility that couldn't afford to keep the heat on at night, that couldn't afford enough staff to take care of their residents, is currently being sued by the Attorney General of New York for allegedly stealing $83 million that was meant to go to resident care. It was stories like Sherman's and Stefania's that compelled so many people to work so hard to pass one of the strongest nursing home laws in the country, but since then, the law was never enforced. Not a single fine has been levied. And as of today, an executive order fully suspending not just the fines, but the law itself was enacted by Governor McKee without any type of plan to address the crisis. The impact for residents is real and tragic. I would now like to introduce Jason Travers, whose father was recently in a Marquis-owned nursing home. Jason?
I want to thank Raise the Bar for allowing me to speak on my dad's behalf and for this opportunity to talk about my dad's experience. My dad's name was George Travers. He had Parkinson's, and when he was in his late 80s, he couldn't take care of himself anymore, so he had to be put into a facility. The facility that he went to is called Morgan Healthcare and Rehabilitation. It's in Johnston, and he entered this facility in December of 2022. He spent his last 4 months at this facility. And in that 4 months, I saw a combination of selfless care by the nursing staff, and I also saw institutional corporate policy that placed an emphasis on profit over compassionate care. I found right away that this place, that Morgan, was grossly understaffed. My story mirrors all of the stories that you've heard today. I think probably it was the same ratio, maybe one person to take care of 15 to 20 patients on every floor at Morgan. And we saw this in the call time between when my dad would press the call button and when a nurse would come to his room to see what was going on. It often went from 15 minutes to 20 minutes to 40 minutes, and even up into an hour before someone came to see what was going on. Now, my father was not a demanding person. He was not high maintenance, but he had a few requirements. He did not like to have an adult diaper. He was a very proud man. He felt like this was not very dignified. But he had to be put into an adult diaper, not because he was incontinent, but because there wasn't enough people to help him go to the bathroom, which was right at the foot of the bed. So he had that requirement. He also required that his drinks were ice cold. And so he had always asked for ice. I never understood that, but that's his requirement. There was an afternoon where I went to visit my dad, and when I got to his room, he said that he had pressed the button to have a nurse come. I said, "What's the matter? What do you need?" He says, "I need ice for my drink." Okay, that's easy. I go to the nurse's desk where the head nurse was, and I told him that my dad needed some ice. Can you accommodate? He tells me that he's going to call somebody. Now, if I turn my back, about 10 feet to my left is the kitchen. But he told me he couldn't go to the kitchen. It wasn't his job. He had a policy. He had to stay behind the desk. So he called another nurse. Wait a few more minutes. She comes and she takes me to the kitchen, and we discover when we open the freezer that there's no ice. So now I'm determined. I take the elevator, I go down to the kitchen. The kitchen's locked, and I look over to my left, and I see that there's a conference room, and there's a meeting going on with people in suits and binders. So I'm determined to get my dad his ice. I knock on the door, I ask kindly, told him the situation, and graciously enough, someone actually removed themselves from the meeting and was able to get me a cup of ice. Great. It shouldn't be that difficult to fulfill a requirement that is as easy as that. Ice should be a staple. There was another time where when I visited my dad in the afternoon, he had contracted COVID that week. So he didn't have a roommate, and he had to close his door. When I got there, they had told me that there was a little bit of an accident. Instead of waiting for someone to come to change him, my dad took it upon himself to try to go to the bathroom. He said he was sick and tired of waiting as long as he did, so he took it upon himself. And unfortunately for him, he fell, and he was in between the bed and the wall. He was there for 45 minutes, and no one came. The only reason why someone discovered him is it was the lunch crew who was coming in to take his tray back. In my dad's 4 months at this facility, I never saw management above the first floor where their offices were. I never saw them interacting with the patients, and I never saw them interacting with the nursing. Those were the people that were making the decisions on my dad's behalf. The nurses I grew to know quite well. And I saw the work that they did. It was very hard work. They never complained about the work that was expected of them. And if they did have any grumblings, it was frustration about some new policy. I asked what the new policies were, and I was told that Morgan, just before my dad came aboard, had been bought out by a larger conglomerate called Marquis, Marquis. And I was to learn later the record of this Marquis, and I don't know if there's going to be someone who can speak about Marquis later on. I don't know much about them, but I was kind of appalled to see what their record was. And so the nursing staff, if they complained about anything, it was the low pay for the work that they do, the hours that they were expected to work. And they also complained about something called, I think it was the traveling nurses. And I didn't know what the traveling nurses were about. And again, someone might be able to speak to that later on. But I was told, as far as I can remember, that the facility would contract out to outside nurses that were paid more than the nurses that were already there. And somehow this was more economical for the facility. And the nurses that were at Morgan seemed to be very frustrated with that system. All of the nurses that I talked to, I always asked them why they chose this profession. And to a T, they all told me the same thing. They said, I wanted to help people. And I found that amazing, especially considering the context in which they were working, because I felt like they wanted to help people, but they were in a system. There's a system in place that makes it very, very difficult for them to help people. There's an old adage that says that we can gauge how civilized a society is based on how that society treats the elderly. And we're not there yet. My dad deserved better than what he got, and we deserve better. Thank you for having me. I really appreciate the time to tell my dad's story.
Thank you so much, Jason, for sharing your dad's story. Your father deserved better. In the last year, there has been a massive increase in immediate jeopardy findings in Rhode Island nursing homes, each one representing a situation that caused or is likely to cause serious injury, harm, impairment, or death. From 2022 to 2023, Rhode Island's immediate jeopardy findings more than doubled from 16 to 38, including at least 8 tragic, completely preventable deaths. We will now hear from Victoria Mitchell, who has worked as a certified nursing assistant for 27 years. Vicki?
Good afternoon, everybody. I have this speech that I wrote, but usually I don't follow my speech. Good afternoon. My name is Victoria Mitchell. I have been a CNA at Lincoln Woods Nursing Home for 27 years. It was Hopkins Manor and McKee's body and named it Lincoln's Woods. I made my career for taking care of sick or people. Some of us love this job. But the crisis in the nursing home is getting ridiculous. Before and now. I see every day they hire new people at my job in the nursing home. After a few weeks, they quit. Why? It's a stressful job. It don't pay. No respect to the staff. It's all about money. Sometimes we work short. Most of the time, I'm not saying even sometime. 7 to 3 care is the main care. We all here, we take care of ourselves every day. We do. We dress ourselves. We give ourselves dignity. We go out there to present ourselves. So when you're sick or wounded somewhere, CNA give you this care. They dress you up. They get you ready. They give you dignity and respect. But if you give us 10 patients in a 7.5 hours, 10 plus morning shift to dress them, feed them, toilet them, reposition them every 2 hours by state law. Tell me, count your hours. Let's look at 11 to 7 shift. We got a 52 unit. You put 2 CNA at night. By state law, you got to toilet them. You got to reposition them every 30 or every 2 hours minimum, but sometimes they range between if they're wet. Incontinent patient got to be changed. We do it. Fine. During the epidemic, we suck it up. We've been fighting for the bill for years. Finally, our senators and representatives listened to us, and they passed this bill. It's disappointing. It's a slap in the face for people that care for residents, that take care of this patient and cannot get no consequences to bad behavior. Wow. In my country, Liberia, if a lawmaker passed a bill and our government keep doing executive order, international community call them corrupt. They sanction them. I'm from Liberia. I follow Liberian politics. They sanction my lawmakers for not implementing the bill. So, Governor Malky, how many times I call you? That's what Liberians say. How many times I call you? 3 times. Do the right thing. You're giving no consequences to corporations that make money. Our patients, our residents, our staff are tired. They are breaking down. We're tired of fighting. But we'll not give up. We will never give up. Because we get better. We'll get better. We depend on you, congressmen. We want you to do the right thing. Because this is going to go worse. How can you do the same thing over and over and you expect different results, my people? Tell me. You take your car, you run it in the wall. The next day you say you run in there, but your car will get different results? We were happy for the bill to pass. But every day, executive order, executive order. My name is Victoria Mitchell. I stand with my resident, not with corporation. Thank you.
Woo! Thank you, Vicki. I felt a moment of hope there. With the average turnover rate for nursing staff in all of our state's facilities at over 50, meaning more than half of all staff left in the last year, it's clear we need a comprehensive strategy that addresses the underlying reasons for the staffing shortage. Low wages, inadequate training, and lack of support for what is often physically and emotionally exhausting work. That's why we are proud to support this new legislative plan designed to make nursing homes safer and more transparent. The first bill will establish the Workforce Standards Board, a regulatory board tasked with creating evidence-based standards for working conditions, wages, and training in nursing homes. It will consist of 13 members appointed by the governor, whoever that may be at the time, and blend expertise from state departments, nursing home sectors, frontline caregivers, and community organizations, all dedicated to systemic improvements. Having heard from some of the key stakeholders for this legislation, I'd like to introduce to you the bill's sponsors. Please welcome the Senate sponsor of the Workforce Standards Board bill, Senator Bridget Valverde.
Thank you. Thank you, Kathleen, and thank you all for being here today, especially everyone who's taken time out of their work days to be here to share your stories, to share your personal stories of being a patient in a nursing home and your family members. These stories are what I hope will propel us to victory with this legislation. So as Kathleen said, I am Bridget Valverde. I am the lead sponsor of the Nursing Home Workforce Standards Board Act. I'd like to thank my Senate colleagues who are here today. We have Senator Oyer, who you will hear from later, Senator Mack, Senator Bazillion, Senator Quezada, and Whip Lawson. And if I missed anyone, raise your hand. All right, I think I got everyone. So as we've heard from the previous speakers, we are absolutely failing some of our most vulnerable Rhode Islanders. People who need care in a nursing home setting, our friends, they are our neighbors, they are our family members. They deserve safety, and they deserve support, and they deserve care that meets their daily and long-term needs. and the dedicated providers who give that care, they deserve a workplace that is adequately staffed, with training that is appropriate and reflects best practices. I don't think that there is anybody here or anybody in Rhode Island or across the country who does not know somebody or has not had a loved one who has spent some time in a nursing facility. I know I have. And I'm sure that we all expected our loved ones to be well cared for. And across the country and here in Rhode Island, there are certainly facilities that are doing a great job. Residents are well cared for, families are happy, and workers are supported. But that is not true across the board. Staffing issues and training issues are contributing to subpar care, and that is just not okay. Every single person who needs care in a nursing facility, every single person, whether they are there short-term or long-term, no matter where they end up getting care, should have a great experience. But care is only as good as the availability and quality of the workforce there to deliver it. And quality care is driven by the setting, maintenance, and adherence to workforce standards. And that's where the Nursing Home Workforce Standards Board, the WSB, will play a very important role. The WSB is designed to be a collaborative body with a diverse mix of members, bringing everyone's voices together. We are proposing a 13-member board that includes healthcare professionals, representatives from the nursing homes, community groups working with the Medicaid population, and representatives from relevant government agencies like EOHHS and the Department of Labor and Training. The board will be empowered to identify trends, diagnose systemic issues, and propose evidence-based interventions that address the root causes of deficiencies in care quality and workforce conditions. It will set minimum training and compensation standards and for nursing home workers to ensure that Rhode Island can build and maintain a robust and competent workforce for jobs that, quite frankly, are going to be more and more in demand as our population ages, as our baby boomers are getting older. But most importantly, it will be a place where all stakeholders, from industry, workers, patient advocates, and government, can come together to share ideas, concerns, and opportunities within nursing home care, where they can be discussed openly and honestly in a public setting. The goal is quality care for all of our nursing homes. Our late colleague, Senator Mary Ellen Goodwin, understood this vision for better quality care when she led the fight for the safe staffing law a few years ago. But we all know that that law has been ignored. So our hope is with the creation of the Workforce Standards Board, we will finally be able to realize the promise of that safe staffing law and ensure that we are meeting the needs of patients and workers in our nursing homes through the use of data-driven policy and practice. So I am so proud to be able to be here with you all today and to work with you in this effort. And I once again thank you all for your time, and I look forward to working with my House co-sponsor, Representative Scott Slater, to get this done this year. Thank you.
Thank you so much for your leadership and your sponsorship, Senator Valverde. Now we'll hear from the WSB bill's sponsor in the House. Please welcome Representative Scott Slater.
Thank you. Good afternoon, and thank you all for being here today. It's a great honor to have you all come up here and support this legislation. The inception of the Workforce Standards Board bill is deeply personal and stems from a collective realization of the urgent need for reform in nursing home care. a realization that has been painfully highlighted through the personal experiences, including my own. 3 years ago, I sponsored legislation for safe staffing that was sponsored safe staff that was inspired not only by stories similar to those we've heard today, but also my own journey with my mother's care. Her experience bouncing between assisted living and skilled nursing facility laid bare to the stark deficiencies in care and oversight that too many of our loved ones face. The WSB, in our response to the critical challenges inspired by the firsthand observations of delayed care, heart-wrenching resident stories, and daunting hurdles encountered in trying to access transparent information about nursing home operations. My advocacy for the WSB is fueled by these experiences along with insights gained from my working on safe staff legislation. It was eye-opening to see the strain on staff who at times were responsible for well over 15 patients each. This is not about ensuring adequate staffing, not just about that, but about fostering a system where quality care, decent wages, and respect for both residents and caregivers are non-negotiable standards. Our aging population is growing, and the demand for nursing home care will only increase. We have a moral obligation to ensure that our facilities are not only adequately staffed, but also held to the highest standards of care and accountability. The WSB represents a pivotal shift towards achieving these goals by integrating the voices of caregivers, residents, and industry experts within the framework of the WSB is poised to tackle the systematic issues plaguing our nursing homes head-on. It's about creating a culture of care that upholds dignity of our most vulnerable residents and acknowledge the indispensable role of caregivers. This bill is more than just legislation. It's a commitment to transforming our nursing home care system into one that is synonymous with excellence, compassion, and respect. As we move forward, I am heartened by the support of my colleagues and allies like Senator Val Verde. Thank you, Senator, for your work on this bill and looking forward to working with you. Also, I've had a lot of other colleagues that have been here today. I see Representative Morales, who's here, Representative Bennett, Representative Deb Filella, Representative Constantino's here, Representative O'Brien was in earlier, also Representative Cruz, Representative, I think I said Bennett. Representative Bennett was here, but you know he's a member also, so I need to doubly thank him. So, with their support, together we stand united in the mission to enact this critical legislation, ensuring that our nursing homes are places of safety, dignity, quality care for Rhode Island's aging residents. The Workforce Standards Board is not just necessary, it's imperative for the future we envision for our seniors and caregivers. And thank you all again for being here today. It's I'm flattered by the support that I've received over the years from so many of you on the legislation, not only for the previous legislation for the staffing, but this legislation. We're going to fight hard and work to get this passed, and I'm thankful for all your support. So.
Thank you so much, Representative Slater, for your leadership in helping pass the Safe Staffing and Quality Care Act, and for continuing that legacy now with a bill that directly addresses the root causes of the caregiver shortage. The tandem piece of legislation we are very pleased to announce is the Nursing Home Financial Transparency Bill. It helps to ensure that public funds are directed to the public good of caring for our most vulnerable, rather than enriching those behind the real estate trusts, private equity firms, and networks of corporations and sub-corporations that treat our nursing homes as mere investment vehicles. By requiring more thorough financial disclosure from facility owners and operators, we are better equipped to ensure that revenues, nearly $100 billion annually of it coming from public funds via Medicare and Medicaid, go to resident care rather than exorbitant hidden profits. We will now hear from the Financial Transparency Bill's Senate sponsor. Please welcome Senator Dawn Euer.
Thank you, Kathy. She, I am telling you, is a force. I chair the Senate Judiciary Committee, and Kathy is in my office pretty much at least twice a week, advocating on this and so many other important issues. So thank you, Kathy, for all of the work that you do on behalf of our seniors. I also want to thank everyone who's spoken and shared their story. I have the somewhat nerdy, boring bill. I actually really love it because I'm nerdy and boring, but it's a little bit more of an bill that will make some people's eyes roll to the back of their head when you start talking about related party transactions and financial reports, but it's so incredibly important. But really, that money is about people. And all of you sharing your stories and sharing the passion with which you are seeking this reform and standing up together, shoulder to shoulder, to do this work is really what this is about. And so I'm so honored to be here with you all today. And I also wanted to recognize Senator Pam Loria also joined us during the speaking program. So Senator Valverde and I were just actually talking. I told her, speaking at the end of the program, Jason stole my quote. She already talked about Mary Ellen, but the thing that we were talking about is how pissed off Mary Ellen Goodwin would be that we have to be here today. For those of you in this room who've been working on this issue for a long time, you know the passion and the fight and the genuineness to which she brought to this issue, how hard she fought to get that safe staffing bill passed. And so the fact that we have to be here today, I'm happy to be able to carry on the torch from the work that she did so well starting, and I'm also sad that I have to be here to do this work with you all today. As Kathy mentioned, billions of dollars flow into this industry. Yet every time we turn around, where's the money? We can't have heat. God forbid you have heat. I know y'all haven't gotten a raise. So there's no money. Where are those billions of dollars going? And it's public money, by the way. This is public money. These are private organizations largely, and it is public dollars. So what this bill is about, it's about transparency and it's about justice. We need to make sure that when our loved ones are seeking the care that they need in facilities, that we can pay the staff what they need to be paid, and we can staff at the levels that they need to be staffed at to provide the quality care to the patients in those facilities. Right now, we know that there's money there. We don't know that from what the industry says, because the industry says the only answer is that we have to raise the reimbursement rate. Well, I'm not comfortable raising the reimbursement rate until we know where that money is going, which is why this bill is important. How do we know that there's money there? Because of the sale of these facilities. The sale of these facilities and private equity would not be involved to the tunes of millions of dollars when these facilities are sold if there wasn't money there. I talked to an attorney friend of mine who does medical malpractice claims. He said he went to a symposium where they actually gave a lecture to industry owners about how they could funnel the money to these different related entities to try to hide from liability from plaintiffs' attorneys like him. They hold seminars on it. Yet right now, the reporting that we have is not adequate so that government officials and regulators can actually follow the dollars. So, as the saying goes, follow the money. Right now we can't, and this bill is about making sure that we can. So, There's been a lot of distressing news and distressing stories today, but I do want to repeat the quote and say, the measure of society is how it treats its weakest members. We are failing right now. But I also heard Vicki, and Vicki said, we're tired, but we're fighting, we're getting better, and damn it, we are going to do it together, shoulder to shoulder, and I'm here with you. Thank you.
Thank you so much for your galvanizing words and for sponsoring this bill, Senator Oyer. For too long, for-profit nursing homes have been allowed to operate in the shadows, and your bill will bring much-needed light to their operations with Senator Goodwin's torch. Representative Dawson is our champion in the House, but he is unable to be here today. We thank him for his sponsorship. The integrated approach of the Workforce Standards Board and the Financial Transparency Act not only aims to meet immediate staffing needs, but also to ensure the healthcare sector is equipped to provide quality care now and in the future. By the end of the decade, 1 in 4 Rhode Islanders will be 65 or older. We must ensure we have a qualified, well-compensated workforce that can meet the needs of our changing demographics. While supporting direct care staff, we will also support owner-operators who prioritize quality care and resident safety and dignity by reining in those who seek only to make a quick profit on the backs of our most vulnerable. Now it's time for us to let our representatives know how important these bills are to us. You can get fact sheets up here, and I or my colleagues can help direct you to find your representatives on the House floor. Thank you again to all of our speakers, and thank you to all of you for being here.